XERF is a super hyped up new skin treatment that everyone's been talking about. I've been getting so many responses and to questions and comments and asking me, what's my opinion on this new treatment? I just got the chance recently to evaluate it firsthand. And I think the results of my experience is gonna surprise you. And if you're new here, I'm Dr. Amir Karam, and as a board certified facial plastic surgeon, with any new technology that comes out, I'm always a little skeptical, but always optimistic. And today I'm gonna give you my full thoughts on this new treatment and whether ultimately it's worth your time and money. So what is XERF? This device was launched in 2023 in South Korea, but it made its way into the US in 2025. Basically, XERF is a relatively brand new radiofrequency skin tightening treatment. It's all happening through the surface of the skin. And this is similar to some of the other radiofrequency devices like Thermage and some of the other ones that basically deliver heat at different levels in the skin and beyond. It's meant to lift the face by building collagen with no needles, no pain, no downtime, and even numbing. And get rid of jowls and neck laxity, all the things that make somebody actually look older. Check, 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 check. A lot of very big buzzwords and areas of concern. Ultimately, there's two things that I want to know. Does it work and is it safe? Like any radiofrequency device that is trying to tighten your face and actually get the shape of the face to look more youthful, you have to target fascia, and it can do this with a deeper mode. Now, I have to say, there's a couple things that make me believe that this is probably going to be a safer treatment. It has an impressive algorithm that basically reads the tissue hydration, that reads the tissue impedance, and gives the feedback automatically so that the device isn't requiring the technician to make moment-to-moment decisions. It kind of does the thinking for you. And this evens the playing field in a good way because it essentially takes out a lot of the variability that can happen when somebody wants to go extra aggressive, go deeper, go longer, and cause some potential complications. That's an important component. One is, as you can see, the device is constantly delivering heat coupled with the cooling of the skin and cooling of that area. So it's not sitting there stationary. Very different from a technology point of view than when you're sticking a needle 4 to 6 millimeters into the tissue that literally is fat at that point, and you're then delivering heat and energy, which naturally is going to melt the fat. It will leave the fat, which is under the skin, safe. I think I wouldn't be surprised, let's just say, if that turns out to be the case. I was obviously very optimistic going into this demonstration. And I want to say also that I'm a surgeon. I can deliver big results. I know I can get what I can get. But if there are patients who may not be ready for surgery and they could actually turn back the clock a little bit with some type of device like this, I think that'd be a wonderful thing. And the representatives were very fair about this, and they said, no, it's some level of improvement. So I think that's really something we got to keep in mind as we're evaluating these things. But what is a meaningful result? That's the question. I think that's a personal question that everyone needs to ask. I mean, I think if you were to ask me, if I were getting a procedure like this done, if I saw 5 to 10% improvement of maybe some early laxity and early, give me a little bit of tightening, I'd probably say that's pretty good. If it lasts too, that's the other thing. It's like sometimes these results can be good in the short term, but then not so good in the long term. But I think a lot of people come into these procedures expecting a lot. And I think a lot of practices overpromise. Now let's talk a little bit about this experience that we had. The company comes in and we really wanted to film them doing the procedure, talking to them, me talking to them, asking all the questions, because I think company policy was that they're not able to be on film or their voices to be on the in the video. So I wasn't able to get that, which I thought would have been really, really helpful to get like a very honest, direct opportunity to hear from them directly. So I was in there and I watched Tonya, our aesthetic nurse, get the procedure done. And I was a little bummed to find out that they're not going to do like a full treatment. Full treatment turns out that it's like an hour and a half, and it's basically one of the two that somebody would get. This is, by the way, a series of treatments. It's not one, it's two. So you get two treatments. It's done, 6 to 8 weeks, something like that apart. And the results get better and better, supposedly to 6 to 8 months afterwards. So keep that in mind, that it's a process of collagen building that can happen over a 3 to 6 month period after each treatment. Unfortunately, we weren't able to get a full treatment. What I can say, and this is important, is the treatment was totally painless, right? As you can see her getting the procedure, no wincing, maybe a little bit of heat here and there, but very little. What was the first impression of this partial treatment? Not so amazing, I think. I looked at some before and afters in their booklets, and I thought there were some cases where there were some changes, some results. But again, who's going to feel happy with those kind of more partial results? It's going to take a lot of conversation, because there's two types of people. There's the type that I just described, which is somebody like myself that would say, oh yeah, a little bit of tightening, I'm happy with. And then there's another person who truly, really wants to have a facelift, but either can't afford it, but they really want the same kind of result. That person's not going to be happy with any of the before and afters that I saw. I spoke with Tonya afterwards. I talked to her immediately afterwards, and then I talked to her literally on the day that I'm filming today. And her impression was not impressed, no change that she can see. Now that's not what I wanted to hear, and certainly wasn't what she wanted to see. But it was a half a treatment and there was no change. And it was really meant to, I guess, just experience the treatment. But me, same thing. I was optimistic. Now I'm not so sure. What I do in every case like this is I go out and I start texting and emailing and calling various colleagues all over the country, Beverly Hills, New York, here, there, wherever, even abroad, and just try to get a sense of what their experience is, what they're hearing. And this is the feedback that I got. Basically, the summary is this. Some patients see an immediate change right after the procedure. There's some tightening, but does it lead to long-term change? Because a lot of those changes happen pretty quickly. They revert pretty quickly. Yeah, it's getting a ton of hype. A lot of people are talking about it. It's all over social media. The results I've seen have been temporary. I don't see long-term results yet. In these situations, when a new device comes out, it's always a good idea to sit on the sideline, observe, let other people experience it, and then get a sense of consensus. And if it doesn't work, this thing's gonna be here today and gone tomorrow. So what's the verdict? As of now, I unfortunately can't suggest XERF with as much confidence as I'd like to have in a treatment. That's my honest feeling about it. I'm still not convinced. It would not surprise me if this is totally safe, but for the same reasons that it's actually safe, it also makes me concerned it may not translate into real change. There's just no studies that are that big, and there's no way any company can make a study big enough to really evaluate complications over time. It's just not going to happen, especially if it's a study that's funded by a company. They're anxious to get this thing to the market as soon as possible. A lot of these complications can happen over a year or two, and you have to follow the same people out for that period of time. So again, jury is still out on efficacy and safety, but safety seems like it probably won't be an issue. All right, folks. Try to give you my most fair and honest assessment of it. If you have done XERF and have had any of these in-office lifting procedures, let us know in the comments. Now, if you do want to know some in-office treatments that I do recommend, make sure you check out some of my videos that speak about these, and check out the Dr. Karam Point of View, which is my weekly newsletter. And if you haven't signed up for it, make sure you do, because it's totally free and it goes in depth on all things related to facial rejuvenation, skincare, wellness, all this type of stuff. Is just my point of view on a lot of this type of stuff. So you'll really find it interesting. And if you enjoyed this video, please give it a thumbs up and share it with your friends who might be considering XERF. And don't forget to subscribe to the channel. And thanks again for watching. Until next time, Dr. Amir Karam.